Hi, Kylie. How are you doing today?
I'm good. How are you, Robbie?
I'm doing fabulous. I can't complain. It was a great weekend. What about yourself? What did you get into?
About the same as far as great weekends go. We just had some pool with the family, grilled out a little bit. This was a good, relaxing weekend for us here.
Perfect. It seemed like the weather was perfect for a pool party too.
Oh, yeah. We had a little bit of clouds, no rain though, but overall, it was a really nice weekend.
Perfect. You ready to go back to work tomorrow?
Definitely not.
I know,
Definitely not.
especially during the summer, I feel like it's so hard to get motivated to get back in there.
Oh, yes, for sure. And you just want to lay by the pool all day, every day, work about 3 days a week is
Exactly.
tempting.
Exactly. Can't complain there. Well, thank you again for meeting up with me. I know that we're kind of getting to the end of what would be a good fit for you and your practice and the doctors that you have there as well as the staff. So I assuming that you have been kind of at least talking to the doctors recently about getting these new cameras in the office. Are they excited about that, or have they kind of stated any questions that they might have or anything at all?
Definitely have brought it up to the other doctors. They have had commentary about that would be so nice and how they kind of can struggle sometimes with the intraoral cameras that we have there now. I think they are interested, but definitely want to know what the feature difference would be as opposed to what I have now and what you are offering.
Yeah, I would say the biggest change that you're going to see, as well as your doctors, is going to be the actual image. So it's going to be a 1080p. So just think about growing up, you were watching the TV, then we got the 1080p, then we got the 4K, and it just keeps getting better and better. So I feel like a lot of people, when they're looking at these images, if it's not crystal clear, they lose that trust and they don't see the value in that photo that you're taking. And so I feel like
Mhm.
that is going to be the most valuable difference that you're going to see in this product is going to be the actual image that you're going to have. It's going to be very crisp, very clean, and your patients will be able to see exactly what you're seeing under those loops. So that's going to be great. It also is going to be auto focused as well. So you don't have to use a dial, you don't have to change anything. You can back it up and do the whole arch, or if you just want to focus on just that one tooth at one time, you can do that as well. So it's very user friendly. It is probably going to be a lot smaller as well than what you're currently using. A lot of those intro cameras are going to be kind of bigger, a little bit bulkier, and they're a lot harder to handle with, you have 8 different things going on, 8 different instruments in your hands. So this you can pick up, take the photo really quickly, and then put it back down and keep going. Another great benefit is you can actually put it on right next to your hand pieces. So it's right there in front of you. And we do have a wireless option for that. So there is a little bit of an extra charge to do the wireless option. So we can kind of discuss that a little bit if you feel like you would need that. But otherwise, it just plugs right into the USB, really user friendly with all the softwares as well. So I know that's another problem that a lot of people have is having issues with the software. Is that something that you've
Mhm.
kind of been experiencing at all?
With our intraorals right now, sometimes we can have difficulties with the compatibility between those and the software. I think sometimes the picture just won't take, and it can just kind of be a hassle too because you feel like you have the camera in the patient's mouth and like taking 5 minutes trying to get like one photo, and they're kind of wondering like what's going on. So you can kind of have that
Yeah.
little bit of awkwardness. I mean, it's not a huge deal, obviously, but it would be nice just to it our time is very valuable. We work on a very fast basis. So kind of something like this, every second, every minute counts, and you want to
Exactly.
be doing something productive. So I mean, even just having something like a camera taking better pictures and having to deal with less of that of a hassle would be better for our practice.
Exactly. And at the end of the day, every minute does count. I mean, that's money that you are trying to use as your production. So if you kind of scale that down into minutes or hours or days, that all kind of adds up into that as well. So I totally understand where you're coming from. And you said you have about 17 to 20 ops. So usually what we will do in this case, since it is a larger amount of cameras that you would be probably purchasing, we would be able to give you a pretty big discount. So you have one or two options. One, if you just want to go ahead and get the 20 cameras, that is going to be your best deal. And for that, it's going to be right around 15,000. And then for each camera that you turn in, I'm not sure how many you have, but we could figure that out for you. It could come in and take a look at those. Then you could get a $500 rebate for each of those. So that's a huge deal. And that's only going to be going on until the end of this month, though. So if that's something you're interested in, we would kind of need to act a little quicker than normal just to make sure that we can take all that benefit into account for you as well. The other option is if you want to share every other room, you can also do that. And the pricing for about 10 cameras is going to be right around 10,000. So you have two different options there. Obviously, I feel like having a camera in each room is going to be more beneficial because there's not going to be that excuse from anybody in your practicing, oh, I don't have one in my room. Somebody else is using it. If it's not there, it's not going to get utilized. And I have seen that in the past. So if you're able to make that little bit more of an investment, then I would say let's go that route for you. So that way you can make sure everyone's on board, everyone will be on the same page. We can train everyone at once. And I think that's really where you'll see the best benefit in your practice.
Yes. As far as something like that would go, I could see if I did do sharing between operatories, I would lean towards more of the wireless option.
Yeah.
And some of those operatories are also hygiene operatories as well, which is something, well, we wouldn't need them as much in the hygiene rooms. So do you have any deals going on compatibility wise, I guess, with kind of a half and half of wireless mixed with like the cord?
Yeah, for sure. So maybe in the actual ops, you could have the ones that are cordless. That way it's really easy for anyone to grab, you or your assistant. And then the other ones in the hygiene room, we can have those corded because they're going to have a little bit more time with the patients. They don't have to be as quick on their feet to be able to get those images. So that'll save you about $100 or $200 on each of those cameras for doing that too.
That sounds good. It's something to think about.
Definitely so. Well, I will go ahead and send over two of those price quotes for you, the one for the 10 and then also the one for I think we said 20, right? Yeah. So one for 10 and one for 20. And then the next time we meet, you can kind of let me know which route you'd rather go down. But I think both of them are a great choice. It's really just up to you and your preference. I know it is a larger investment, but the investment on return, you're going to see that back really quickly. Honestly, within not even 6 months, you're going to see the difference in those. So, and again, if you have any problems, any concerns, you can obviously reach out to me, anyone on my team, and we'll be glad to come in and take a look at the practice and see how we're able to help you gain the patient's trust a little bit more, especially with the newer doctors and the hygienists and stuff.
Yes, it's also something I think I need to ask my team around and how the hygienists, especially how they think they would utilize it, because I think they can have a bigger difficulty integrating new technology in than what the assistants do. I think the assistants are kind of their job description. Their job is made easier with this new and improving technology, and the hygienists, I think they can come about it like their job is a little bit more tedious, more is going into it, more they're having to learn. So I think just the job descriptions, it just kind of has two different effects with both of those. So they'll definitely kind of have to ask around and see how they think this would benefit each one, according to hygienists and dental assistants.
For sure. And do you feel like your hygienists have a pretty big impact on your patients? Like, you feel like if they tell a patient that, hey, you have this problem, that they're pretty receptive of that?
I definitely think a hygienist and a patient, if it's a good hygienist, develop a lot of trust with each other. It's someone that they see if they're coming regularly every 6 months. So if they're coming regularly for their cleanups, they're bringing their families there. They request this hygienist over and over. They just like seeing them. It's kind of like I mean, going to a hairstylist or just, you know, someone that you make appointments with and you have a trust with, like your trusted family physician. And I definitely think if their hygienist says they see something suspicious, they would be more likely to get the treatment done. They're thinking the hygienist is looking out for their best interests and not trying to make a penny off of them.
Exactly. Well, it was great talking with you again. I'll go ahead and send that over. Do you want me to send that over to your personal email or to your work email? Which one would be better?
Send it over to my work email so I can kind of send it to my team as well.
Okay. Sounds great. I'll go ahead and get that together today then, and I'll send that over to you. And if you have any other questions or concerns, obviously you have my number, or you can just reply back to that email and then we'll get those answered for you. Okay.
All right. Perfect. Thank you, Robbie.
Thank you. Have a good night. Bye.
You too. Bye.